Hello everyone, welcome to my channel. Please subscribe to my channel. In this video today we are discussing about the anti-tubercular agents. This is the medicinal chemistry third year second sem subject. I'm explaining about the anti-tubercular drugs. First of all, the introduction. In introduction, we'll discuss about what is tuberculosis. Tuberculosis is most important communicable disease in the world. Mycobacteria are intrinsically resistant to most antibiotics, so it grows more slowly than other bacteria. So for the effectiveness, we use antibiotics which have active against rapidly growing cells. Lipid-rich mycobacterial cell wall is impermeable to many agents. It grows inside macrophage, poorly penetrated by drugs, excellent ability to develop multiple drug resistance. So in introduction, we'll be discussing about the tuberculosis and the how the drug acts against the tuberculosis. So we can give combinations of 2 or more drugs to overcome these obstacles to prevent emergency of resistance during the course of therapy. The response of mycobacterial infections to chemotherapy is slow. Treatment must be administered for months to years depending on which the drugs are used. So after the introduction, we can move ahead for the classification. In the next part, we have the classification. The anti-tubercular agent drugs are most oftenly classified into 2 groups. They are clinical. According to clinical utility, the anti-tubercular drugs can be divided into 2 groups. As I told you before, these are first line drugs and the second line drugs. The first line drugs are having the high anti-tubercular efficacy as well as low toxicity. These are routinely used. The second line drugs are low anti-tubercular efficacy or high toxicity, so they are not used routinely. In a very high cases with a combination of drugs, the second line drugs are used. In the first line drugs, there are different types of drugs will be discussed in forward. The first line drugs are more routinely and oftenly used drugs. In this we have the first one is isoniazid, second one rifampin, third one pyrazinamide, ethambutol, streptomycin, etc. The first drug is isoniazid. Here the isoniazid structure and the chemical name pyridine 4 carbohydrozide. The isoniazid is isonicotinic acid hydrazide, most active drug for the treatment of tuberculosis. It is freely soluble in water, bactericidal for actively growing tubercular bacilli, less effective against a typical mycobacterial species. Penetrates into macrophages and is active against both extracellular and intracellular organisms. The next is a mechanism of action of isoniazid. In this, we'll see basis of resistance, inhibits the synthesis of mycolic acids, essential components of mycobacterial cell wall, highly selective for mycobacterium. And the properties, it occurs as a white crystalline powder, it is odorless and has sweet taste, it is soluble in water, it is incompatible with aldehyde and ketone. The storage affected by light. The uses of isoniazid are used in the treatment of pulmonary tuberculosis, used in the treatment of meningitis and genitourinary infections, and the preparations of isoniazides. Ethambutol. The next drug is ethambutol. Synthetic water soluble, heat stable compound dispersed as the dihydrochloride salt. Here the chemical structure and chemical name of the ethambutol. Mechanism of action of ethambutol, inhibits mycobacterial arabinosyl transferases, an essential component of the mycobacterial cell wall. Resistance due to alteration in target gene, no cross resistant with other drugs. Properties: it occurs as a white crystalline powder. It is odorless, bitter in taste, and hygroscopic in nature. It is soluble in water and alcohol and insoluble in chloroform and ether. It is a dextrorotatory. Uses of ethambutol are used in treatment of pulmonary tuberculosis. The other brand names are here. Next drug of first line drug of antitubercular agent is pyrazinamide. The structure of pyrazinamide and the chemical name of pyrazinamide, relative of nicotinamide, stable and slightly soluble in water but weak drug, inactive at neutral pH. The mechanism of action of pyrazinamide: the pyrazinamide is converted to pyrozinoic acid active form by microbacterial pyrazinodase, disrupts mycobacterial cell wall membrane metabolism and transport function. The properties are: it occurs as a white crystalline powder. It is odorless and has slightly bitter taste. It is sparingly soluble in water but soluble in ether and chloroform. Storage and stability. Clinical uses of first line drug of antitubercular agents: second line drugs are: first drug para-amino salicylic acid. The structure and the chemical name and the introduction to the para-amino salicylic acids. It is a second line drugs. These are most not used routinely. It will be high specific for M. tuberculosis, not effective against other Mycobacterium species. Combined with isoniazid, this drug will be given with combination to the isoniazid drug in 250 mg increments to recommended dosage. Intense gastric irritation and neurologic symptoms as well as hepatotoxic. Ethionamide is chemically related to isoniazid drug, so in some cases it will be given in combination. The drug occurs as a yellow crystalline substances. Melting point is 164 to 166. The brand names for this is amidazine, ethionamide,